Welcome to Meriter Hospital, where you matter.
Where you matter.
Where you matter. And where you matter. Where you matter.
Where you matter.
One of our most important team members is Carla. Her title is administrative assistant, but all of our pharmacy team members would agree that she is the backbone to our pharmacy department and takes care of each and every one of us. Our central pharmacy is involved in filling, dispensing, and compounding sterile and non-sterile preparations for the floors. Pharmacists, nurses, and other team members may be in contact with Central Pharmacy 24/7 to facilitate safe and efficient medication delivery to patients.
So Meriter is part of UnityPoint Health, which is based out of Cedar Rapids, Iowa, which is a multi-hospital system. What is a little bit unique about Meriter, they're also aligned with the University of Wisconsin. Both of those hospitals are located in Madison, Wisconsin. The relationship between UW Health and UnityPoint Health Meriter is through a joint operating agreement, where UnityPoint Health Meriter and UW Health are aligned from a financial perspective. I'm actually employed by UW Health, and I spend 50% of my job at UW Health and 50% of my job at UnityPoint Health Meriter.
We have a pretty small management group here. We have our director of pharmacy, and we have 3 pharmacy managers, an operations manager, we have a drug policy manager, and myself as the clinical manager. I've been in this role for about 15 years. Part of my job as a manager, I supervise about 40 pharmacists in the department, and I also have some indirect management responsibilities for the residents, mainly things like scheduling the residents for their rotations, and also signing their time cards and overseeing their management or practice management rotation while they're here at Meriter. The infectious diseases residency is a little different than the PGY1 in that it's not quite as structured. You have much more opportunity for elective rotations. You also have longitudinal rotations, and probably most importantly, you go through a lot of projects as part of the PGY2 residency. Those stem from either long-term projects that the department identifies, or as the resident meets and works with other preceptors, both here and at the University of Wisconsin Hospital.
I will be your primary preceptor for your year-long longitudinal rotation in drug policy, which will encompass formulary management, medication use evaluations, coupled with a focus rotation precepted by Allison Malachek on drug safety.
I'm the lead pharmacist for the medicine rotation that you guys will be doing if you come here to do a residency. Typically we have the medicine rotation early in the year, so it's one of the first rotations that you guys would do. It's a really good rotation to kind of get you guys' feet wet, get to know a lot of the providers that you'll be working with throughout the year. You get to know a lot of the nursing staff as well. On the medicine unit, we have 44 bed, we have 2 pharmacists that cover that those patients, and we get to see a good variety of patients, everything from infectious disease to alcohol withdrawal, heart failure, lots of things that you would see on other units as well. So we spend a lot of time during this rotation kind of doing topic discussions, going through patient cases, and really getting your feet wet in these common disease states that you'll continue to see throughout your year and throughout your career.
Welcome to Adult Psychiatry, otherwise known as 1 East. This is a 17-bed maximum unit that includes an acute side as well. We typically treat patients with lots of different diagnoses, but most commonly we'll see bipolar affective disorder, schizophrenia, depression, anxiety, substance use disorder, and sometimes personality disorder. What I like most about working in this environment is the multidisciplinary approach to managing patient care, and just in general, the team cohesion. People we work with here are the providers, the nurses, the mental health technicians, the social workers, and the occupational therapists who have a really big role in patient care. The pharmacist role usually is helping to manage psychiatric medications for the patients, in addition to helping to manage other disease states that the patients may have while they're on this unit. We manage remotely the Child and Adolescent Psychiatry Hospital on the west side of Madison. This is a very newly updated 30-bed unit for children aged 6 to 18. We also are involved in discharge medication counseling and psychiatric medication education group.
Our emergency department has 26 beds and we see approximately 40,000 patients a year. We see everything from pediatrics through geriatrics, acute care through chronic medical conditions. Really our motto in the emergency department is to bring upstairs care downstairs and really try and optimize the care of our patients from the moment they hit our door through their potential admission to the hospital. We also provide outpatient culture review for patients who are discharged from the hospital, and we work under a collaborative practice agreement with our emergency department physicians, which allows us to modify prescriptions or potentially prescribe new medications as indicated based on their culture reviews. And as a resident here at Meriter in the emergency department, you'll have an opportunity to work side by side with our pharmacists, learn collaboratively with our emergency department providers and nurses, and also interact daily with our emergency department patients, both inside the ER and also after they leave the emergency department when calling them with their culture reviews.
We are a mixed medical and surgical 24-bed intensive care unit. While you're on rotation, you'll be joined by the ICU pharmacist at daily rounds, and along with the pharmacist, you'll be joined with an intensivist, medical residents from the UW School of Medicine, nursing staff, respiratory therapy, and a dietitian.
This is a unit that covers both oncology and IMC, which is the intermediate care area. Kind of a step-down unit for the ICU, if you will. And what we see here are, especially on the IMC side, we'll see patients like alcohol withdrawal, GI bleeds, diabetic ketoacidosis, and then we also do oncology patients. All the it's 15 beds here, and they all can house a leukemic here. It's kind of a state-of-the-art oncology area. We only do maybe 5 chemotherapies a month. But in that, the pharmacist here is an integral part, communication with the nursing staff, communication with the patient, from start to finish.
Primarily, we have lots of strokes there. We also have Parkinson's disease, various other neurologic immune disease that we treat with all different interesting medications. And we happen to have an older population, which is also part of my specialization. I am certified in geriatrics. And I got started in that because it reduces readmissions by addressing geriatric specific outcomes for people.
The services that I provide or precept students is in areas of nutrition support, along with some consult services that our department provides. It's in glucose management, anticoagulation, and pain management. So first off, while working with the surgical patient population, when TPN is required, our service essentially manages the patient's parenteral nutrition therapy. So we'll coordinate that with our dietitians, but the pharmacy department is responsible for putting together all of the TPN solutions, ordering the lab work, and just essentially overseeing that component of the patient's care. So the providers essentially cede the control over to us to manage that.
We're up here on 11 Tower, which is the cardiology unit. It's a 45-bed patient care unit. And we have capabilities of providing services at an IMC level or intermediate care level for our patients up here. We also cover the cath lab and short stay unit, which is one floor below us. We have at least 5 cath labs down there that we also do service patients for. And because of all those beds, we actually have 2 pharmacists on this floor usually.
And up here on this cardiology unit, we do a lot of anticoagulation. So you'll get very familiar with warfarin dosing, heparin dosing, enoxaparin, and some of our less commonly used agents like argatroban, or even things like eptifibatide.
And then I also have additional roles. I function as our student coordinator for the department, so I work a lot with our pharmacy students. And then I also help out with our residency program and do a lot of kind of the organizing and coordinating for our pharmacy residents here at Meriter as well.
We have a 40-bed unit with an average census of about 30 babies a day. We take care of premature babies all the way up to term babies with a variety of different medical issues. We do bedside rounding with the medical team. So you're involved in a group setting with medical residents, with medical students, with respiratory therapists, with dietitians. We have the whole gamut of people that are here to round on each patient every day.
Meritor is the largest birthing center in the state of Wisconsin, and we do about 5,000 deliveries every year. To support that, we have 16 labor and delivery rooms, 3 OB-specific ORs and PACUs, 10 antepartum rooms, and 48 postpartum rooms. As a key member of the care team, we review admission and discharge medication reconciliations, we perform patient profile reviews, we verify orders, and we go on interdisciplinary rounds.
It's a friendly place where people say hi to each other in the halls. It's very nice.
The culture, the climate, the people that I work with.
I came here as a resident and stayed because of the people.
People come and they love to stay.
As I did my residency here and then continued to work here, I feel like I have really great relationships with all the providers, nurses.
Response we get from the providers.
The multidisciplinary approach to managing patient care and just in general, the team cohesion.
We have great interdisciplinary practice.
We all work very closely together as a team in order to get the job done.
Also, we have a communal candy drawer.
But it's that ability to kind of encourage and foster new development of clinical roles here.
I get to work on a lot of different projects.
And our innovative department practices.
Because each person is given allowance to develop their interests.
Hopefully we can meet in some other real forum at some point, and good luck to you all.
I look forward to working with you if you choose UnityPoint Health Meritor.
I look forward to meeting you.
I hope that you guys have a successful residency interview process and hope to see you guys next year at the start of the new residency year.
Hopefully, Meritor is a good fit for you, and best of luck to you.
Thank you very much for coming. Have a good day.
So I would encourage you to come to Meritor and join our team.